Hello, I'm Dr. John J. Smith with Susu Health Foundation. I am a Liberian urologist in the Seattle area. In our previous video, we encouraged you to get vaccinated with any COVID-19 vaccine that is available to you. Now, I've been following the news about the COVID vaccines very closely, and with the recent concerns about the AstraZeneca and Johnson & Johnson vaccines being associated with blood clots, I wanted to hopefully, circle back around and just shed some light on this for you. Now, the blood clots that we're seeing after these vaccines are not your typical clots. So they're forming in veins in the brain and in the abdomen and also in arteries. So we're not just seeing, clots that form in the veins in the legs. And the clots after the AstraZeneca vaccine have been found to be very similar to what we see in people who have a reaction to a medication called heparin. Heparin is a blood thinner that's used to treat people who develop blood clots. For some people, when they're treated with heparin, they can form antibodies to platelets, which are the blood cells that help you make clots. And it's called heparin-induced thrombocytopenia, where people are treated with heparin for blood clots, and now they develop antibodies to a factor on the blood clot cells, the platelets, and that causes them to form more clots. So the clots that we see with AstraZeneca have been related to these same types of antibodies, the platelet factor 4. Johnson & Johnson is kind of similar to AstraZeneca in that it is an adenovirus vector vaccine. So it probably has the same mechanism. We still need that. That information isn't out yet, but it's probably the same mechanism. Now, these clots are serious. They are extremely rare, but they are serious. So let's put it in perspective and compare. Let's look at some numbers. Let's compare the odds of getting clots from AstraZeneca and Johnson & Johnson vaccines to a couple of other things. And let's hope that helps put things in some perspective. So as promised, here are some numbers to help put this in a bit of perspective for you. So at the top of the slide, we see the AstraZeneca vaccine. 222 cases of these blood clots were seen after 34 million doses. We already talked about Johnson & Johnson, where we've had 6 cases in almost 7 million. But let's look at, other situations with blood clots. So looking at these same brain blood clots that we've seen with the vaccines and looking at them in the general population, that happens, 2 to 14 in a million, right? And if you look at the percentages there, they are not that far off from what we see with the vaccines. Look at the risk of blood clots with COVID-19 infection itself. 165,000 cases in a million. What about the risk of blood clots in women on birth control pills, or cigarette smoking, or riding in a plane for longer than 8 hours? Now some of these blood clots are not the clots that form in the brain, but they can still be dangerous, like the stuff that forms in the deep veins in the legs and get to the lungs and can be fatal. So these can still kill you. So I just wanted to put these numbers up here so you see, we don't stop riding in a plane. Like, I wouldn't say I'm not flying from here to Liberia ever again to see my family because of this risk of blood clots. So that's why I wanted to put this in perspective. So think about some of these things like birth control pills and smoking and plane rides and how they relate to risk of blood clots. And that's where this whole looking at the risk versus the benefit comes into play. Now that we've looked at the numbers, let's talk. So from a public health perspective, these clots are considered rare events, right? 1 in a million. But I understand that from an individual perspective, this can be scary. So what do we do with this information? We look at the risk and the benefits as they relate to the individual. So these clots, the blood clots, have primarily happened in young women. The 6 women with clots after the Johnson & Johnson vaccine here in the U.S. where all ages 18 to 48, and they developed blood clots within 6 to 13 days of getting vaccinated. When we look at AstraZeneca, the blood clots were primarily seen in women over the age of 60 within 2 weeks of their vaccine. So we're looking at women under the age of 50 to 60, right? All right. Now, AstraZeneca is not used here in the US, but it is the vaccine that is available in Liberia and in other countries in Africa and around the world. Several countries temporarily suspended the use of AstraZeneca last month, and that caused a lot of concern. We were looking at several countries in Europe who suspended the use of AstraZeneca, and I had some conversations with people who are going, well, if it's not good enough for them, why is it good enough for us? But again, that was temporary, and it was just based on, taking a step back to look at the data and figure out what was going on. And some of those countries have since resumed use of AstraZeneca vaccine, but kind of on a conditional basis. And what I mean by that is they looked at the data and looked at the age groups of people who have been affected, and they have decided to to stop using AstraZeneca in younger patients. And I'll give some examples. So Spain and Italy are restricting the use of AstraZeneca to patients over 60 years old. So in Spain and Italy, they're using it in patients over 60. Canada is over 55. Germany is another one that's also restricting the use to people over 60. And these are countries where, they can afford to do that because they have other options for vaccines to treat their younger patients. Now, much like these European countries temporarily paused on AstraZeneca last month, when the data was coming in, we've seen the same thing happen here in the US, where the Johnson & Johnson vaccine has been paused. And this has caused a lot of concern, which is understandable. Now, does this pause mean that the vaccine is not safe? I'm going to say no, it doesn't mean that. Because from a public health perspective, we are seeing an event that happened in 6 women out of almost 7 million. And this is considered a rare event. I like numbers, so let's put it in perspective again. This is similar to your risk of being struck by lightning in a given year. The risk of being struck by lightning in a given year is 1 in a million. So it's similar to that. But I'm not trying to make light of this, right? So what does this mean for you? Because that 1 in a million is a rare event until the one happens to you or somebody you care about. So from an individual perspective, should you be concerned? My answer is it depends. And I'm not being nonchalant about this. So, when I say it depends, let's think back to the age groups that have been affected by these blood clots. Women under 50 for Johnson & Johnson, women under 60 for AstraZeneca. So it depends on your risk. It depends on your age. It depends on your options for vaccine. So if you are under 60, especially if you're, let's say, a young woman in your 30s or 40s, and you have access to other options, go with other options, right? If you are under 60 and you don't have any other options, then you really need to weigh the pros and cons based on your underlying health, your risk of exposure to COVID, and, take all those things into consideration and have that conversation with your doctor. So somebody asked me, what would you do, John Jay, if this was you? Well, I've already been vaccinated. I've had my 2 Moderna shots. But I am a young woman. Yes, I'm young, in my mid-40s. But if I wasn't vaccinated yet, looking at this data, if I, and I live in a place where I can get Pfizer or Moderna, I would get those. Now, the question is, what would I do if I lived in a place where they were not available? Like if I lived back home in Liberia, then I would look at it this way. I work in healthcare. I am seeing patients. I don't know who's vaccinated, who's not. I don't know who maybe is positive and doesn't know it yet or whatever, right? I'm also working at I'm volunteering at a vaccine clinic. Well, if people are coming in to get their vaccine, especially if it's their first dose, that means every single person I'm seeing on that day is unvaccinated. So I have to do everything that I can do to protect myself and my family. So when I look at it from that perspective, I would get the vaccine because, I'm wearing my public health hat and I'm saying it's a 1 in a million risk. Would I be a little worried? Oh, yes, I would. That voice, that little voice in the back of my head would be asking me, John J, you sure? What if you were that 1 in a million? So yeah, I would have that little voice in my head, but I would get the vaccine. So the bottom line is, please just look at the data, look at the science, weigh your pros and cons, and just have that discussion with your doctor. But don't let a rare event be the thing that makes the conversation end. So at least have the conversation. So what are the symptoms that you would have with these blood clots? What should you look for? If you have severe headache, abdominal pain, leg pain or swelling or shortness of breath within 3 weeks of the vaccine, you need to go to the emergency room. You also need to let them know that you were recently vaccinated for COVID because that helps them know what types of blood thinners they can use to treat you with if you are diagnosed with a blood clot. Now, where should you report these vaccine side effects? Keep in mind, if you have a severe allergic reaction, call emergency medical service, go to the emergency room. When I talk about reporting side effects, that is assuming that you are safe, right? So for Johnson & Johnson, I have the information on here, both for the CDC and for Janssen, for the manufacturer, that you can contact directly, both online or calling a number. AstraZeneca, I could not find a number for you, but I do have the link from their website. And this information will be in the chat below, so you can click the links and go to the websites for online reporting. Okay. Thank you for watching this video. I really hope it was helpful. If you want to stay informed on updates and future videos, please subscribe to our YouTube channel. You can also join our mailing list by emailing info@susuhealthfoundation.org or follow us on our various social media channels, which are shown here. Thank you.